So, hey dancers, thanks so much for tuning in today. I am thrilled to be joined today by Dr. Angela Jones, an award-winning and board-certified obstetrics and gynecology expert, who is going to share with us some, insights on common experiences that dancers have with period and feminine health that maybe we don't talk about that much because, those subjects are not always the most comfortable things to bring up. But I think it's great to have Dr. Angela here to shed some light on what you all might be going through or what many of you might be experiencing, and to just give us some additional expert insights. So thank you so much for joining me, Dr. Angela. I really appreciate it.
No problems. It's a pleasure to be on your show. Thank you so much for having me.
My pleasure. Thank you. Why don't you start just by telling us a little bit more about your background? I did see on your blog that you wanted to be a doctor from the time you were really young, and I think that's kind of amazing. So just what's your story?
My story is really easy. I'm a Midwesterner at heart, but we've been in New Jersey for maybe like 8 years or so, and we love it. But yes, I always knew that I wanted to be a physician. It was just kind of one of those things that was in me. I didn't always know that I was going to be an OBGYN, but I always knew that I was going to have a career in medicine. So I always tell people, when your children tell you what they want to do, believe them. And and so, I ended up choosing OBGYN because as a third-year medical student, it was the first rotation that I had. And I was completely blown away. Medicine, surgery, and hanging out with women. It doesn't get any better than that. And so long story short, I've been a practicing OBGYN for, I'm going to say going on 14 years, and I now reside in Jersey. I'm a minimally invasive surgeon, so I do a lot of robotic cases and laparoscopic surgery. But really the impetus behind, the whole Ask Dr. Angela brand has really been just educating and empowering women. And quite frankly, I always tell people this is really more for me than it is for them, because I have such a great time putting out all the materials that I do, whether it's the podcast, my blog post, or my videos.
Awesome. I love it. Yeah, I was perusing your website, like I mentioned, and I think there's so much valuable stuff on there. For me, like I said, currently being pregnant, but I think that women of all ages really should seek out more of that information to just kind of educate ourselves so that we are more empowered when we go to the doctor to ask questions and just to feel comfortable in that environment, because it is women hanging out with women. So I like that you said that too.
Yeah.
And, you should feel comfortable with your OBGYN.
Absolutely.
So, awesome. So getting into some topics, some questions that come up for dancers. What is amenorrhea?
If I'm going to just make this really simple, and I'm all about keeping it very simple so that everyone understands, A means without. So amenorrhea means without period. It just means that you don't have a period for whatever reason. I mean, there are numerous reasons that women don't get a period. And I mean, if you want to go into that, I'm happy to go into that. But amenorrhea, in its essence, is just not getting a period. It means you are without a period.
And that could be at any age.
Well, usually you don't diagnose that until you're at least like 15 or 16, depending on which literature you're reading. And that's primary amenorrhea, if you haven't gotten a period by 15 or 16. Secondary amenorrhea, which is probably what most dancers have, means that you were previously getting periods, and then for whatever reason, and there are many reasons, you are no longer getting a monthly period.
Yeah. Why do you think dancers are more likely to have amenorrhea?
Well, that's really a no-brainer for me. I mean, most dancers are, in some of the best shape that you could be in. I mean, body composition-wise, dancers have minimal body fat, mostly muscles, very lean. And so that primarily is their reason for not having a period. I mean, you got low body fat, you guys undergo rigorous and intense training. So those are the top two: low body fat, crazy exercise, dance routines. Stress. I mean, how many dancers are not stressed?
That's very true.
Yeah, stress affects
mindset. Yeah, and the stress that I work with dancers through, it's a lot. Yeah, for sure. So what is the recommended treatment for amenorrhea in dancers specifically, would you say?
Well, this is the thing. I mean, knowing the primary cause of amenorrhea is the primary thing. And I mean, if you're amenorrheic or without period just because you're dancing, then I don't know that it's so much an issue as long as lifestyle wise, you still continue to be healthy. You know, you're eating well, you're obviously exercising. I don't know that necessarily I would put you on a birth control pill just to induce a period, specifically if there's a known reason.
That's interesting for me to hear, just because I do feel like, and this might just be my perception, the common practice is if you're not getting a period, they want to put you on, or the doctor wants to put you on birth control.
Well, I'm going to answer it like this. I am not they.
Yeah. True that. True story.
And the other thing that I'm going to tell you is that I have actually a fair share of women that are on birth control pills that don't get periods.
So if you wouldn't go the birth control route and you do think it's okay that they're not getting periods, is there any underlying concern or something or anything that dancer should be concerned about if they're not getting a regular period?
Again, as long as there's a known precipitating factor, I'm not going to tell you to stop dancing. You say, oh, just stop dancing. You know, you gain a little bit of weight, you get a period back. I'm not going to tell you to do that because, again, it's like a cause and effect kind of thing. It's when we don't know the underlying reason behind it that it really becomes more of an issue for me.
Mm-hmm.
And in people that are that concerned about it, sure, you know, I can give you some medication. Usually a progesterone withdrawal, Provera is what we call it in my realm, is something that can be given to kind of start or initiate a period. But again, as long as we know the inciting factor, I don't know that there's anything really to do at that point.
Cool. Do you have any tips for dancers who get intense cramps and periods but don't really have the option to take a day off because rehearsals, class, it still has to happen every day?
Okay, so you just said a very key phrase for me. Cyclical, painful periods.
Mm-hmm.
Okay, so in my realm, i.e. the realm, the wonderful realm of OBGYN, that's endometriosis. Okay.
Wow, okay.
And, you know, that's one of those things that is so underdiagnosed. You know, women think, oh my gosh, it's just a period. It's supposed to be this painful. I'll suck it up, you know, get through it, etc. When things like, you know, non-steroidals, those are those category of medications that include, you know, common things like Aleve, Motrin, ibuprofen. When things like that, and I call those conservative measures because most of us just have those in our medicine cabinet. But when that's not working, when, you know, heating pads aren't working, dancers are already amazing athletes, so you're already exercising. But if that's still happening to you, that might be the one circumstance where I might say, you know, you really might consider a low dose birth control pill. And a lot of times birth control pills get a really bad rap because I'm going to tell you, one of the first questions out of every woman and young girl's mouth when we initiate pills is, oh my gosh, Dr. Angela, you know, I don't want to gain weight. And it just cracks me up because what I'm going to tell you is that, and you know, I've been doing this for a long time, birth control pills, you know, they do not routinely, that's the operative word here, they do not routinely cause women to gain any more than the normal 3 to 5 pounds that most women will gain around the time of their period. Okay, whether or not you're on the pill or not, most women, just because of the hormones associated with the cycle, will gain, you know, roughly 3 to 5 pounds. Birth control pills aren't going to cause you to gain weight. Okay, I can count on maybe one hand in my 14 years of practice the number of women that I can say, well, you know what, maybe that did happen for you. But I would initiate a low dose birth control pill. And, you know, if it's endometriosis, the way that we treat that gold standard is typically hormonal suppression.
Okay. Yeah, that was a good point because, you know, I think, like you said, most women, but I guarantee 100% of dancers would ask you that question before they went on birth control. So I think it's great to hear that. I think that it is one of those, I guess, very common misconceptions then. You know, everyone thinks, oh, if I'm on the pill, I'm going to gain weight.
I know. And I'm just going to throw this plug out for birth control pills specifically.
Yeah.
You know, one of the things that no one really knows about birth control pills, which I actually think are probably its biggest benefits, are that they are protective against ovarian and uterine cancer. And no one ever mentions those benefits, but those are probably, in my eyes, the two biggest reasons to go on that. So if you're someone that's on the pill and you're gaining weight, it's probably because of your lifestyle. You're not eating right, you're not exercising, but dancers pretty much have that under wraps.
Yeah. I get asked about bloating a lot, and I'll often suggest some dietary switches that could help. But do you have any additional tips for dancers who deal with bloating during their period and maybe have to perform during that time?
I think your recommendations are good, primarily just dietary.
Mm-hmm.
But otherwise, dancers are doing all the right things, with regards to the amount of activity that they're doing. There's nothing else. I mean, again, if you decided that you wanted to try a pill, it certainly would help with that as well.
Cool. So to kind of wrap up, what would you say to highly active people, or we'll stick to women, obviously, highly active women, dancers, what are the main things they should be doing to ensure that they're taking care of their female health?
That's a really good question. I mean, just doing the obvious things. I'm a huge lifestyle advocate. When I see women every day, just for regular annual exams, I always ask, how are diet and exercise for you? I never say dieting because, I don't really believe in dieting. We should be eating healthy every day, all day, every day. And so I'm a huge lifestyle advocate. I think that as long as you are doing those things, being active, going in for your annual exam just to touch base. I always tell women, visiting your OBGYN is way more than just a pap smear. When I visit with a patient, it's kind of like a recap of what's been going on with you for the year, And so I think that as long as you are someone that's leading a healthy lifestyle and you are getting your, routine annual exams, you should be good. And the other thing is just not being afraid to ask questions, being able and being comfortable enough with your physician to ask questions that you might deem to be embarrassing. This is kind of one of the reasons for my platform, because I like just, making topics that might be kind of sensitive to women more, in the forefront so that they're not so taboo.
Yeah, no, I love that. And what age should women, period, start seeing a gynecologist or an OBGYN?
I recommend in ACOG, which is the American College of OBGYN, actually recommends a meet and greet with your friendly OBGYN, usually between the ages of like 13 and 15.
Awesome.
And that's a good visit. And I always tell moms, tell your daughters, there's no exam associated with that visit. It really is just an opportunity to sit down, kind of get to know the new young patient and just kind of give them an introduction of who I am or what we do and kind of, what, future visits may or may not look like.
Amazing. Well, thank you so much, Dr. Angela. That's all I've got.
You're welcome.
This is super valuable information for dancers. And I think that, it's a culture that doesn't necessarily talk enough. So I think, unfortunately, young dancers especially, I think this is most young women have a hard time at first with gynecological conversations.
Sure.
But, I think dancers can be especially quiet and not necessarily open to the questions. So I'm really excited that we'll get to share this information with them.
Thank you so much for having me on. Really appreciate it.
Thank you.